Welcome, everyone. It's wonderful to have you with us today. We are just waiting for a couple more people to be joining us, and we will start in a few minutes. But thank you so much for being here.
In the meantime, we are celebrating Veronica's election victory.
Yes, Abdullah, we must meet one day.
Yes,
I can tell that sense of humor thing is
I feel the kindred spirit connection as well. Do you know David Price, Congressman David Price?
I've met him. I don't know him well, but I've met him, yes.
He ran unopposed 16 rounds of elections, as you know. And
it's a little disconcerting to run unopposed. I have to tell you, I was a little surprised. People said you should take it as a compliment. I think I frankly would have preferred to run with an opponent because then it would have allowed me an opportunity to talk more.
Mm-hmm.
I didn't know when to, do I want to beat people up over the head with this? I didn't put my signs out till the first day of early voting. And, it's like, I don't want to be obnoxious about this.
Okay, I think we have a quorum, so why don't we go ahead and start? Abdullah, I will let you take it from here.
Good afternoon, everyone. Thank you for choosing to spend your time with us for this remarkable panel of two great scholars, public intellectuals. My name is Abdullah Entepli. I'm a professor of religion and ethics here at Duke University and also associate vice president and provost. They call me AVP Square. On community engagement, I'm a colleague to both Liz and Alicia here. My job is to get everybody's attention, which is already there, and introduce our wonderful panel. We are here to discuss making environmental injustice legible, community academic partnership for knowledge co-production and action on the health impacts of subsistence fish consumption from the lower Cape Fear River. And we are joined by two great scholars and experts. I will start in the alphabetical order. Dr. Elizabeth Shapiro-Garza, who we call her Liz, Associate Professor of the Practice of Environmental Science and Policy at Nicholas School of Environment at Duke University. She is also a faculty director of Community Engaged Scholarship and a colleague, and again, a resource to all of us. And she's a human environment geographer whose research explores the ways in which human communities interact with environmental initiatives and approaches meant to influence their management practices and behaviors, and the role that broader economic, political, or policy trends, as well as inequality in access to power and resources, play in those dynamics and outcomes. She has over 30 years of experience. She started right after elementary school in community engaged practice and research, having partnered with agricultural producers and cooperatives, indigenous communities, government agencies, and community-based nonprofits in Mexico, El Salvador, Peru, Colombia, Guatemala, and the southeastern United States. I don't see Canada here. Liz will be doing some work in Canada as well. And Liz is joined by Veronica Carter, councilperson from town of Leland. Veronica Carter is a retired Army officer. We are grateful for her service, and former civil servant, over 38 years of experience managing complex logistical operations under austere conditions, internationally and domestically. Upon retiring from the Army, Veronica joined the Department of Peacekeeping Operations at the United Nations in New York as a logistics officer. Her responsibilities included developing, budgeting, planning, coordinating, scheduling, and implementing logistical support plans related to the deployment of existing and new operational missions in Sierra Leone, Burundi, Liberia, Ivory Coast, Cote d'Ivoire, and Congo, Zaire. In 2004, Veronica moved to North Carolina, to our joy, initially working as the Director of Administration and Logistics at Military Ocean Terminal Sunny Point. Since 2013, she has devoted her time in service to the communities in and around that southeastern part of North Carolina. Please, the floor is yours.
Abdullah, thank you so much for that wonderful introduction and invitation to speak and to speak more about the work that Veronica and I have done together in coalition and in collaboration with an amazing group of communities and community-based organizations in the Lower Cape Fear region of North Carolina, which is where Veronica is coming from us today. We will be speaking a bit about that collaboration and the strengths that we see in collaboration, the roles that communities can play in those types of collaborations, the roles that academic universities, academic institutions, and academics themselves can play as well. Just to give you a bit of background though, too, one of the hats that I wear is as Director for Community Engagement for the Duke University Superfund Research Center. And the Duke University Superfund Research Center is, as it would, the name would imply, is based here at Duke University. It is a group, a collaboration as well, of researchers who focus on the environmental and health effects of chemical contaminants in the environment, with a strong focus on the ways in which early life exposure, so in utero or when you are a young child, to chemical contaminants can have later life effects on health and on reproductive outcomes as well. We are a small but mighty team. We are made up of me, my associate and colleague Kara Klein, and my associate and colleague Sam Cohen. So just to say, this is not a huge, our community engagement team is not huge, but we have great might and strength through our connection and collaboration with communities. And that's really how we think about our work and how we think about moving forward. Our mission is to serve as an organizing hub and a source of support to great people doing amazing things in the world and providing the support that we can. Just to give you a bit of background though, too, to take it one step back, this is a lunch and learn event hosted by the Collaborative and Community Engaged Scholarship here at Duke. And I do find it useful when we're talking about community engaged scholarship to provide the definition that we use, because it can mean a whole lot of things depending on where you're sitting, your experience with scholarship. And so these words each have their own meanings. So the definition that we use is that community engaged scholarship involves partnerships between community and university addressing issues of shared importance and demonstrating mutual benefit. These partnerships co-create knowledge by employing expertise and resources in a range of scholarly activities, including teaching, research, and engagement. So that's the definition that we use, and you can see that it's pretty broad. In this definition, scholars are not just based at universities or colleges or other academic institutions. Scholars are people who produce knowledge in the world. And when you have community engaged scholarship, it is co-produced. That means that it's an act of co-producing knowledge between community and university partners and in partnership. And co-generating that knowledge is oftentimes in service of needs within the communities where the research or the scholarship is being practiced. The approach that we use at the community engagement core of the Duke Superfund Research Center is known also as participatory action research, and that has a particular meaning as well. And Veronica will be talking much more about the, especially the action component. I'm just going to take you a little bit through our model and how this type of research works. It is iterative, and that's one thing to point out. There's a circle here on the screen, and there's a reason for that. The idea is that it's really important, if you are going to be doing community engaged scholarship, to first define community relevant questions. So to work with the communities that you are hoping to co-produce knowledge with, to define those relevant questions and figure out what is going to be most relevant and impactful for them. Understanding and then to understand who is already doing what, who holds knowledge already that might be useful for answering the questions that you've designed. And then you actually conduct research, or you can call it, again, community engaged scholarship, knowledge co-production. You then work with community partners to translate the findings into action. And so a really important component of this is the action part, is thinking about how the knowledge that's been generated can be used, right? How we want to use that to inform our moving forward in the world with however the community defines that. You synthesize generalizable lessons learned, replicate, disseminate, and rinse, wash, cycle, squeeze it out, and start again. Veronica and the coalition of partners that we've worked with have gone through this cycle a number of times together. with slightly different variations of partnership. And Veronica's smiling. She'll talk about this in a second. But this is basically the process. And this is an abstraction. We're going to get into some very specific details of what this has looked like in relationship to our partnership as well. So again, just to say, for the Duke Superfund Research Center, we focus on 3 different areas of issues of health and environmental impacts of chemical contaminants in the environment. We do work with communities near former industrial sites to reduce exposure to legacy contamination. We also work to reduce exposure to chemical contaminants in soils and community and home gardens. But the focus of the talk today is really about this top one, which is to collaborate with subsistence fish consumers to reduce exposure to chemical contaminants in fish. And this might seem strange, right? Is this really such a big issue? Why would we be focusing on this? But it is, yes, very much so, especially here in North Carolina. One thing you may have noticed if you were living in the state of North Carolina is that there is a whole lot of water. Actually, right now we are in drought, but even so, there are a lot of water bodies. And partially because of that, there are a lot of people who like to fish. And a lot of those folks actually do eat the fish that they are catching. Why is that an issue, though? It is a deeply culturally embedded practice for a lot of the folks who are here called North Carolina home, whether they're recent immigrants or have been here for generations, or in some cases, especially with tribal communities for millennia. It isn't certainly an issue for them because it's a cultural practice to catch and consume fish. The reason it's an issue is that many of the waterways, whether they're rivers, lakes, or streams, in North Carolina are what are called impaired. And they have high levels of chemical contaminants, whether heavy metals such as mercury, or more emerging concerns, or emerging contaminants as they're known, such as PFAS, PFOAs, which you may know as forever chemicals. But one of the more highly impaired waterways in a state with many of them is the Lower Cape Fear River. And you can see on the map here, it is in the southeastern portion of the state. You can see, if you've been to Wilmington or know where that is where the Cape Fear empties out into the Atlantic. One of the reasons it's impaired is it's a very large watershed, and it has a lot of land area that it drains. And because of that, there's a lot of stuff that's draining into that river. That can be everything from contained animal feeding operations, which are very heavily concentrated in this upper part of the watershed. It can also be from coal-fired power plants, which have been throughout for a very long history, of industrial production and use along the river, as well as Air Force base or military bases, which are their own sources of types of contaminants as well. Because of that, and this is the bottom of the watershed, right? This is where everything is flowing down. There also are a number of existing what are called fish consumption advisories. So the state of North Carolina sets these advisories based on their understanding, their assessment of risk from consuming fish that contain chemical contaminants. There are a number of existing fish consumption advisories, and as we'll discuss, there are now more because of the work that we have done in coalition with our partners on the Lower Cape Fear. There's also significant concerns, again, with what are known as forever chemicals, PFAS, PFOAs, which are chemicals that do not degrade rapidly and have significant health concerns as well. I'm going to pass it over to Veronica to discuss more about these issues.
Thank you, Liz, and thank you, everyone, for allowing me the opportunity to talk a little bit about my home. I'm not originally from North Carolina. I'm originally from Brooklyn, New York, as you can tell from my thick New York accent. And my 20 years of being in the Army and traveling around the world, and then, frankly, I've been here almost 20 years. So it's been a long journey. We're going to talk about environmental justice issues. And of course, environmental justice is really more about environmental injustice. No one should actually be forced to live in a polluted area purely because of their lack of wealth or their skin tone, their national origin, their immigration status. And those are all categories that come under environmental injustice. The EPA, and there's an federal executive order that define environmental justice. You all are bright folk and know how to do literature reviews far better than I do. So I'm going to say that you already know what that means. If you don't, talk to me later. I'll give you a good EPA definition, or Dr. Liz over here will. But environmental justice is something that I got involved in by accident. When I moved here with my late dad in 2004, we purchased his first home. And it was in the outskirts of Leland, the LA area, as folks like to call it, the Leland area. And he was very proud of it. And he came home one day from the Piggly Wiggly. So, you know, we really live in the South. And he had a handmade flyer that said, there's going to be a landfill, big landfill here. And, you know, you need to come talk about it. Okay, well, landfills do serve a purpose, I suppose. So I said, yeah, you go handle it, Daddy. Let's see what happens. My dad is a retired mailman. I'm a first generation college graduate. My mom had passed away, which is how we ended up here in North Carolina. I'm an only child. I needed to get him out of New York and out of Brooklyn. And so I thought, okay, this will be a great opportunity for him to go meet people and get involved. Look at my dad, the activist in his mid to late 70s. Look at him. And he came back from the meeting and said, you really need to come with me to the next meeting. My mom and dad, regardless of where I was in the world, always got their money's worth out of my college education, because they would mail stuff to me and then say, okay, we're going to talk about this next time we talk on the phone. So read up on it. I knew something was up, and what was up was that this was no ordinary landfill. It was going to be full of something called auto shredder residue, which is after you take everything that's recyclable out of a car, you then crush what's left and put it someplace and hope that you can sell it to a third world country or second world country, and they'll take it off your hands. Meanwhile, while it's sitting there waiting to go to those countries, very toxic metals, heavy metals are leaching into the soils. Well, we're on the coast here, so my sea level is probably about a foot down before I start hitting sand and water. So that was a concern. And oh, by the way, they were going to put this 750-acre landfill, 350 feet tall, in a predominantly African-American community in a county. I live in Brunswick County, the most southeastern county, that is 70% white. Go figure. That already had a Superfund and 5 brownfields. That's how I was introduced to environmental justice issues. After we successfully kept that landfill from happening, with joining a number of other groups, grassroots groups throughout the state through the Solid Waste Management Act of 2007, finally got some use out of my political science undergraduate degree after all those years. So I was pretty proud about that. We then started getting calls from other groups and communities in the area talking about their issues. Liz mentioned that the Cape Fear River is impaired. It is badly impaired. At one point, there was actually a move afoot to possibly categorize it as a swamp or one step below a river, because it was really that polluted. It had cement factories, it had CAFOs, it had coal ash ponds. There's an actual recreational lake called Sutton Lake, right across from Wilmington and right across from Navassa, that is part of the Duke Sutton formerly coal-fired plant. And so they took the cooling ponds needed to cool the coal ash and roped some of them off and made a recreational lake out of it. So right next to the coal ash, stored coal ash, was this recreational fishing lake. There were no warning signs there. Nothing that said, oh, by the way, the fish that you're eating are right next to all this heavy metal coal ash over here. Oh, by the way, the rest of the river, the rest of the water that's coming down here has possibly chicken and turkey and pig poop in it. And oh, by the way, there used to be cement factories here, and we just shut them down about 20 years ago. So you go ahead and eat that fish and enjoy it. Well, I was standing on a riverfront, much like you see that picture there, talking to some folks from EPA Region 4 in Atlanta and saying, I really need your help here getting DEQ to do their job. They were Diener back then. And they looked at me probably like, I think Abdullah put in the chat, he was wondering about people really eating the fish. You and I might not eat the fish out the Cape Fear River because we're blessed enough to have the assets to go buy some other type of fish, go buy fish, freshwater fish or cleaner fish and what have you. There are a whole lot of families that I see sitting on those banks, and especially on the weekend, fishing. And I can look at the folks and look at the kids and know that they aren't fishing just because they're catch and release or this is fun. They're fishing because that's a way to supplement their diets. Because maybe it's towards the end of the month and maybe their EBT benefits didn't quite last as long as they were hoping they were going to last, but they need that extra bit of protein to get over to the next month to feed their kids, to feed themselves. And those are the folks I was concerned about. And, you know, I kept talking to the regulators and they kept saying, but you have no scientific evidence. This is all anecdotal, you know, because of course nobody ever does qualitative evidence here anymore. So that's where Liz came in, because they were nice enough to mention at EPA, oh, by the way, we have these EPA problem-solving grants. You should apply for one. Not a problem. So we joined up. I'm on the board of directors for the North Carolina Coastal Federation, and we work a lot with the Cape Fear River Watch, which has our Cape Fear River Keeper, Kent Burnett, in it. And we basically joined up together and got a grant and started looking for someone, all you nice, good scientists at Duke and other places, that could help us prove that, one, people really did eat fish out the Cape Fear River for subsistence, and two, the fish they were eating was actually really bad and contaminated. But here's the kicker. You can't tell people not to eat the fish, because if they're eating the fish because they don't have any money, and this is all the way they're getting their protein, to tell them don't eat the fish is ridiculous, because they have to eat something. So maybe there's cleaner fish. We all know that catfish swim at the bottom and they're probably the dirtiest fish. But again, I only knew that anecdotally. I didn't have any scientific evidence of that. That's what our study was about. Next slide, please, for whoever's doing the slide, sorry. Okay. So, you know, you see Stop Titan, that cement company. We've got, I like to say, if it's something polluted, we probably have it here in southeastern North Carolina. We got wood pellets, we got methyl bromide, we got PFAS. We were the, you know, ground zero for Gen X with Deflop Canopy showing up and taking water out the Cape Fear River and discovering the forever chemicals were all over the place. So we needed to figure out how to prove, have actual scientific proof that yes, people actually eat fish out of the river. And yes, the fish were actually polluted from chemicals in the river. But oh, by the way, some fish weren't quite as polluted as other fish. So if you have to eat the fish out the river, maybe you should eat these fish instead of those fish. Next slide. Okay. Don't know what that was. Next slide. Yep, there we go. So if you're going to go walk up and ask somebody, are they fishing? And and you don't look like me, you know, and maybe don't look like Abdullah, and you walk up to an African American family or an undocumented Latino or Latina family, and you say, "Hey, are you fishing over here?" and you look like a white guy, they're going to think you're the game warden asking for their license, or they're going to think you're ICE about to take them away or something. They're not going to answer your questions at all. They're just going to shut down. No, we haven't done anything wrong, sir. Please don't hurt me. So what we knew that we needed to do was partner with folks, and we needed training. We said, they'll know us. They'll know people, community activists. If we show up and say, hey, man, what'd you catch? You got something, you know, what are you doing? Where's your good fishing holes? They would tell us, but they weren't going to tell Liz necessarily, because they don't know who she is. She's just some white chick who showed up and said she works for Duke, you know. Sure you do. So what we did was we recruited folks from the community who folks knew. We also realized that if what we thought was going to happen, if our what do y'all call that, a thesis, you know, it was, you know, if you thought that here's our question, okay, if we can prove our question is actually true, then we probably needed to tell people how to fix stuff so that they would actually eat it, the lesser polluted fish. And so we actually recruited two chefs, well-known chefs in our area. They're both James Beard nominees, multiple years, Chef Dean Neff and Chef Keith Rhodes, who's the big guy standing next to me. He owns Catch. We had the NAACP, as you can tell, Wake Forest School of Medicine. So we had some really good folks and players here. And more importantly, just community folks, coaches, Little League coaches, who happen to also be elected officials, who could walk up to townspeople and say, hey, what are you eating today? And we knew they would answer. We needed the chefs because just because I tell you to eat this fish, if it doesn't taste good and you like fried catfish, you're not going to eat it. So we need to make sure it tasted good, and we gave them recipes because, again, we live in the South, and if we could fry water, we would. Next slide. Hey, I think that's you, Liz, because it has something to do with, it sounds scientific. It has to be you.
You could do this too, Veronica, but I'll go ahead and do my best. So one of the things that we decided to do then, again, as you saw in that cycle of participatory action research, one of the first things to do, of course, is defining the problem, defining the questions we want to ask and answer. And as Veronica said, that's what we did with this group of people. Actually, they did it, and then we came in and figured out how to, with them, figure out how to co-generate some knowledge around it. And that's what we did. We really did figure out that, for one thing, we wanted to characterize subsistence fish consumption. So as Veronica said, who is actually consuming fish from the Lower Cape Fear River from this highly impaired waterway? And what are some of the issues? How can we better communicate, understand the risk, the health risks that poses, and then communicate those risks? So the problems that we identified, and this was identified with this group of amazing community partners, this coalition that we just Veronica just discussed, but also then this is some of the research that we uncovered, or the information that we uncovered in the process as well, was that one of the issues was that when you eat a fish from the Lower Cape Fear River, it's not going to kill you immediately, right? It is a low dose of mercury. It's a low dose of Gen X. And that means that it's oftentimes people aren't aware of the risk at all. And one of the quotes actually from some of the research that we did, or the folks we talked to, said, "Been eating it all my life and I still have all 10 of my fingers and toes," right? So not recognizing that if you eat a lot of this over time, especially if you eat it when you're young or in utero, it's really going to have huge health consequences later on, but not immediate.
And Liz, let me just cut in. Let me just cut in
Yeah,
there. Anecdotally, those same people that would sit there and say, "I still have all 10 of my toes," or whatever. You say, "So let me ask you, how many people in your family have like are older than 60? How many people have made it to 65 to Social Security?" You find out there are entire families with no sibling. They grew up on the property, ate the fish, all that good stuff. Everyone in the family would die before they turn 65 from some form of cancer. And, while again, that's an anecdotal story, when you go back and talk to the scientists at EPA or anything else, you're sitting there going, something's wrong with this picture, folks. Okay. There's got to be some sort of link between all of this. And if you point that out to them, wait a minute, your sister, your brother, your father, oh, by the way, you're a cancer survivor, and all of you got this stuff in your 40s and 50s. You don't think maybe it's something that you're eating or drinking? Go ahead, Liz. I'm sorry.
Yeah, no, thanks for that further piece of information. I mean, I think that's the context we're working in, right? Is a real recognition that there are serious health concerns involved. But needing, as Veronica was saying, right, needing to prove that to people have some power to do something about it. And in order to prove that, we need numbers, right? We need a Duke University. We need the SAO, something that was published by Duke University saying this actually is an issue. And again, that's coming from our community partners. That's why they brought us in. Some of the issues too that we uncovered were that the population of fish consumers were diffuse and very diverse. So it makes it hard to communicate to them. There are low levels of education and English literacy, and distrust of government and experts. You can see actually in the picture here, this is one of the beaches on the upper part of the Lower Cape Fear River called Redneck Beach. And you can see these warning signs. There's alligators in the river. It says no swimming. There's actually was a sign right close by about a bacterial contamination that would cause open wounds. And there are people swimming. That is definitely, again, through the research that we did, one of the things that we found was that there was distrust of government and experts. And then you're going to be having a distrust of any kind of official warnings that come out or discussion of risk.
And no fish, notice there's no fish advisory sign there. Literally, when I was standing by the coal ash pond with the EPA regulators and trying to tell them that, yes, this is a recreational fishing lake, they went, nobody fishes here. A guy, like I had hired him, walked up and said, "Hey, do you know what's running today? Anybody catch anything today?" And I looked at him and said, "Yeah, okay, thank you, sir. No."
Yeah. Yeah, it is. And again, even when you do have the fish, the postings, people don't necessarily trust it. If they do understand it, they don't necessarily trust it. it makes it really tough, right? This is a tough population to then communicate risk to, because they don't trust what you're giving them. And the message is really tough to get out there. And they aren't seeing immediate effects of the risk that you're discussing. So it's really, really tough.
And that's why those community partners, the coaches, the pastors, the folks that they know and trust, become so important to be teaming with the scientists, with the folks from Duke and the medical, the doctors. Because one, many of these neighborhoods don't have, they're a desert for doctors. They're a desert for pharmacies or supermarkets or anything. So if you can have those trusted agents working with you, where these folks, they've been to their houses, they go to school, they went to school together, they trust them. If they bring Liz into their house, Liz is okay, because they know how to get back to the person that brought them into their house.
But if I showed up on my own, what would
You ain't
happen?
getting in the door.
Right. That's right.
Not without a gun. Yeah.
That's right. That's right. I don't carry. And that's why we need to be doing this together, Veronica. Yep. So just to say, one of the things too, just to provide some select results from the research that we did do together as part of this coalition. There were a high percentage of people fishing from the Lower Cape Fear River that are consuming their catch with low stated willingness to stop doing so, as Veronica stated so clearly. And people will not, they're going to keep fishing, and they're going to keep eating fish from the river. The fish are being shared, so children and pregnant women do have a relatively high rates of consumption. A lot of people, when they catch fish, they're sharing it with their friends and their neighbors and their families. There are high levels of metal contaminants, mercury, arsenic, chromium-6, and also organic contaminants, PCBs, dioxins, that are present in the fish. And so the ways that one of the things that's important then is to emphasize eating fish that are lower on the food chain, or lower on the food chain, fish that eat plants, not other animals, because they will not have bioaccumulated some of these contaminants. Also, removing fat from the fish is a way to get rid of some of the contaminants. The organics contaminants actually will concentrate in fat tissues, and so if you remove those, you'll have lower exposure. And unfortunately, though, we found that people were eating fish that were very high on the food chain. So catfish, largemouth bass, bowfin, which are fish that eat other fish, and so accumulate contaminants at a very high rate and are very highly contaminated. They also happen to be the most tasty and the largest mass. So
larger fish. Right.
And they're larger
They go
fish.
further.
And so they feed more people. That's right. There's little awareness of risk posed by chemical contaminants or of the advisories against them that give information about the risk. And that, as Veronica said, that the trusted sources of information are friends, family, fellow fishers, some local organizations, and local news. So just to point out, and Veronica has already said it, a lot of this knowledge was already held by people in the community. They knew these things. And they could have told you that, and they did tell it to the EPA regulators, but they needed proof, right? They needed to have Duke University come in and collect data in a systematic way with community members, I will say, but they needed to have that in order to then make their case and to advocate for change.
And frankly, just to figure out how to put an advisory sign up became a bit of a challenge, even for our friends with Duke. Because there was no step-by-step, here's how you get a fish advisory sign posted at a local fishing hole. We have that now. We now know how to do it, but it was because of the researchers at Duke trying to figure out how to do that and actually putting it pen to paper and saying, okay, here are the steps that you need to take and here are the offices you need to call. Because if it was just some grassroots group out there on the Cape Fear River, good luck.
So what we did, here we go. This is the action step. So this is actually how the coalition of community partners that we worked with, we worked together to design what's called the social marketing campaign. And social marketing uses the tools of marketing and the strategies of marketing, which is very effective, right? I'm using an Apple computer right now because of the joys of marketing and the power of marketing. You use the tools of marketing and the strategies of marketing to promote social good, right? And messages that are for the social good. So what we did, and I really do mean we, all of us, came up with this campaign called Stop, Check, Enjoy. And the campaign really focused on a very simple, hopefully simplified message, which is part of a marketing strategy, is to keep the message simple. Because we had found out that fish with the highest contaminant load is most consumed, right? The catfish and bowfin and largemouth bass. We say stop, right? Stop eating some fish from the Cape Fear River. These are the ones that are going to cause greatest harm. We know you like them, but just consider that they are really highly contaminated. We found that there was little awareness of issue or fish consumption advisories. So then what we did, we said, check the advisories. If you're going to be consuming fish, then at least check the advisories to see what is safe to eat. And we did find out that people were not willing to stop eating wild caught fish. So then we said, enjoy. If you're not going to stop eating fish at all, then let's give you some ideas of what are safer species to eat. And so then we said, enjoy. So what the components of the social marketing campaign, and I'm going to have Veronica's going to take us through some of the materials that we created together. But basically it is that there are simple tested slogan that suggests specific actions. That's one component of a marketing strategy. So Stop, Check, Enjoy is that. It's emotional messaging tied to findings that families fish together and share their catch. So we used a lot of imagery and messaging around keeping families and kids safe, which is also tied into the fact that kids are more vulnerable to the contaminants that are present. Clear communication of the risk that evolves with new data on safer fish. So you can see here we suggest very specific species that are not safe to eat. So in this case, we are saying this is the stop part. Please stop eating these particular fish, especially if you're a kid or under 15 or woman age 15 or to 45 who are likely to become pregnant. And then also providing easy access to further information. We provide a lot of different links, easily accessible to other places of information. And because we found that people had greatest trust in information coming from local organizations, we featured their logos. So you'll see Veronica had mentioned Cape Fear River Watch, the Coastal Federation, and a local health department.
And the NAACP.
And the NAACP, of course. Yes. So Veronica, you want to talk about the materials?
Yes. So what we did was we thought about where would these materials be best, because one of the things that you scientists do, bless your hearts, is that you do a lot of really great research, and then you go to your conferences and you do poster boards and you brief each other and you publish your stuff in peer-reviewed articles and you all applaud each other and you get kudos and accolades, but you never ever go back to the neighborhoods where you got that data and tell them what the heck. And so some of these neighborhoods are tired of that. They're like, I feel like a guinea pig. These people come in here and ask me all these intrusive questions. And then what do they do with my information? So one of the things that we wanted to say to folks was, whatever you get, we're going to have to go back and tell people about it. Not just to stop, check, and enjoy, but we're going to tell them, here's what we found out. But we need to do it in a way that they understand. That's not insulting to them, that they'll remember, and that they can go, oh, wait a minute. Those chicks, the guys and the chicks from Duke, they came and they said, what now? How do we do that? So, military, keep it simple, right? Stop, check, and enjoy. Here's something that folks will use. What will they take with them? Well, the bottom right-hand corner is a fillet. Liz mentioned that if you get the fat out of certain fish, it makes them safer. I don't know about y'all, but I'm from Brooklyn again. I go to the fish market and tell them to fillet my fish, okay? I'm not doing the fish gut and all that stuff, okay? I like fish, but I'm not cleaning it. So if I know how to clean it, though, and I know I can see where I need to cut it a certain way, that will make it easier. I now have that magnet sitting on my refrigerator, okay? So we gave out those. The calendar in the middle was something that was actually a really big hit. We were able to leave those not just at little stores, and we have all the materials you see on the far left in both English and Spanish, because many of the people that we saw fishing and doing subsistence fishing were undocumented folks, and they really were living in the shadows because of the situation where they don't necessarily know who to trust and where to trust. So there are a few groups here in the Cape Fear region that folks understand, a few churches that they know are safe havens for them. that's the places that we would reach out to. We actually, whenever we had an event and went back into the community to tell them the results of what happened, we would have a translators that the community knew and trusted, that worked with either the social Department of Social Services or the health department, and were able to make sure that our translations were spot on and that they could always go back to if they got the information later and had questions and know, oh, that person works over there. I can go ask them, because they were at the little festival that we had. The chefs came out and did demonstrations of how to fillet fish. They also, in the calendar, are recipes, okay, from our chefs, both Keith and Dean. And again, if it don't taste good, people aren't going to eat it. They're just going to go back to fixing it the way that they know it tastes good, which here means fried, deep fried, which of course is the most unhealthy way to fix fish. So we showed them that you could fix fish. You didn't have to fry it. You could broil it. You could bake it. And if you use these different herbs and different things that weren't that you could actually grow in your garden, it could taste good too. And we gave them samples. So they went home with a magnet. They went home with, here's the fish you should eat and shouldn't eat. And they went home with a calendar full of recipes and some more information of where they could find further information in English or Spanish, whichever language they were most comfortable with. And it went over really big. One of the things we did, and Liz didn't understand this culturally, was we said we need fans with Stop, Check, and Enjoy on it. Okay. And they're like looking at us like, see, Abdullah just looked up like fans, you know, like fans, Abdullah, you know, like, because see, in the Black church, it be getting hot. And we give out in the Black churches, you have all these fans with MLK's picture on it and stuff. Well, now in the Black churches, there are fans that have Stop, Check, and Enjoy on them with all the contact information. Okay. They're also in Hispanic churches as well. Okay. So that way, when they go give out fans, when it's getting hot in the summertime and they're fanning, they can sit there and go, remember when they came back and did that? I'm going fishing later today. Let me take the fan with me and make sure, or take a picture of it and take it with me. So that we no longer have any fans available, because the fans, I think, went first. They probably went before the calendars did. But those are things that if you're talking to neighborhood community members, they'll come up with those ideas and say to you folks that may not think about it, because you are brilliant, but you know, it's just not your lane. They'll be able to help you with. You help them with the scientific stuff, they help you with the cultural and how to reach out to the folks in the neighborhood stuff. Okay? So, Liz.
Yeah, and sorry, I didn't mean to advance the slides so quickly.
That's okay.
Yeah.
It's probably time.
So one of the other things we did too, again, recognizing, or because we had found out, and again, this is maybe not rocket science as Veronica would say, but that trusted channels of communication were really important, right? That hearing from people, that organizations that they trusted was really the most effective way to reach people who were consuming fish in Lower Cape Fear. And social media was a really important way to do that. So people, organizations that were trusted could send out information through their social media channels to reach folks. So we created a social media campaign, and this is actually what's called a social media guide. It's again, the campaign material, the Stop, Check, Enjoy campaign material, but structured in a way that makes it really easy to post it along with all of the images, the graphics, and the text that need to go into it to Facebook and Twitter and Instagram. If you want to use Snapchat, you can, but formatted in a way that makes it really easy for local organizations, low resource organizations to be able to use it as well. Veronica, you want to take this one?
I'm sorry, I'm answering Abdullah in the chat there. There we go. He said all the taste was in the fat. I was just updating him on that. So we actually had a festival, because again, I said to you that most of the time you guys go in the neighborhoods, you go do your research and go away and publish great peer-reviewed articles and, you know, publish and don't perish and all that good stuff, and just are happy and move on to the next research. Well, we needed to go back to the neighborhood and say to folks, no, here's what we found out, because we also knew that whatever we found out from this particular study, we might want to, or someone might want to take that and take it to the next level, which meant you might need to go back to those same people and ask them, hey, remember when we were here before? You want to leave them with a good memory, okay? And so we did community fairs. We went back to the neighborhoods. You see that we had little cute activities for the kids pretending to fish. Again, everything in English and Spanish. So up in the upper left-hand corner are some of our translators and stuff. We use the Latinx group at UNCW to get out to the community as well. A lot of those kids actually live in the community. They're from this area in the Lower Cape Fear. And so they took a lot of that information home with them. They are the trusted agents in their community because they're their first generation college graduates and college students. So we were able to use them. Dean Neff, one of our chefs, who's the owner of Seabird, is over to the right with Liz and myself. He actually did demonstration projects along with Keith Rhodes, where they actually used their recipes, showed people how easy it was to make and then sample. And folks went, oh, this is pretty good. And then he talked about things, simple stuff that folks might want to know. This really isn't that expensive. You can grow your own tomatoes. You can grow your own onions. You can season it this way. And if you do this, this, and this, look, it was almost like a cooking show out under, and oh, by the way, it happened to be the hottest day of the year that we did this. I should point, not when I had the sweater on, but one of the festivals when we were in the t-shirts, it was literally the hottest day of the year. It was horrible, but people came out. People still came out because they knew that we promised them we would be there. We promised them free food. And they did. They were kind of curious as to, well, okay, they came and asked me all these questions and we showed them where our favorite fishing hole was. What are they going to do with it? So those are some of the, you see Dean Chef, or the chef Dean Neff down there at the bottom right-hand corner with a fish. He's getting ready to fillet that and then demonstrate one of his recipes. So next slide. We did a video series. Yes.
Yeah. Go for it, Veronica.
We did a video series. Chef Keith Rhodes is to my right there from Catch. He actually in the video series did a recipe. He actually in a little YouTube video, you can go on YouTube right now and watch it, where he talks about the Stop, Check, and Enjoy program, talks about why it's important to him. He grew up in the neighborhood himself. He's a product of the Wilmington area. So he's like, okay, self-taught chef. Hey gang, my grandfather taught me how to cook. And yeah, but let me tell you how you can hook this up, how you can kick it up a notch and not have to necessarily fry it and it'll taste good. Deborah Dix Maxwell, who at the time was the president of our local branch in New Hanover County and who is now the state convention chair for North Carolina for the NAACP. She's the state president. Was also part of this journey. Deborah's a retired social worker, public health social worker in Brunswick County. So she had a lot of connections and a lot of her former clients still remember her and trust her as a social worker. So she also, if she comes and says, hey, listen, you need to listen to these folks, that's yet another trusted agent. Next slide. We'll keep our fingers crossed to see if this works.
Yeah, and I think we may actually not have time to watch the whole thing.
Okay.
I'll show a bit if I can play it. I'll show a bit of it. But one of the other trusted agents in this part of the world is Veronica Carter, who you all now know. And so Veronica and Deborah were featured in this video that we put together. I'm going to play just a bit of it, and then we'll move on.
And about the Stop, Check, and Enjoy program, which was a collaborative effort to identify contaminated fish consumption in the Cape Fear River.
Subsistence fishing is an environmental justice issue because there are people out there who really need that extra bit of protein, but they can't afford it. And it's an environmental justice because it's not their fault that the river is impaired. We have polluted the environment, our Cape Fear River.
People like to fish, and a lot of it is for sustenance because what they don't get, they take and share with others. When my father fished, the whole neighborhood never knew a fish market till he stopped. So we're always trying to educate our community more about the environmental injustices, and this is one of them. People are being adversely impacted by the recreational and subsistence fishing because of the chemicals. The need to address the contamination of fish in this area is an environmental justice issue, and because it adversely affects people of color.
And so it upsets me to see people who may need that fish to eat, to get protein into their diet, to make sure that their kids have actually something a little bit more substantial to eat, be forced to eat something that I know isn't healthy or isn't safe. To do nothing and just watch that take place just didn't seem like the right thing to do. The Stop, Check, and Enjoy campaign came up when we were trying to explain to EPA scientists, as well as some of their administrators, that we had families that were living off of the fish that they were catching in the Cape Fear River. Unfortunately, all we had was anecdotal evidence. While we were out here trying to talk to people and gather support for our campaign, we noticed that there were whole families out here fishing, and they were taking those fish home to enjoy. And we make up a group of nonprofits, academia, governmental agencies, and NGOs that have all come together to try to ensure that you enjoy safe fish when you eat fish out of the Cape Fear River. The Stop, Check, and Enjoy program is so important for everyone to remember. Stop, look around before you start fishing, see if there are any fish advisories. But you have to remember that if you are a woman who may be pregnant, is pregnant, or if you are a child under the age of 15, you need to be especially mindful of those health advisories and what type of fish you're consuming. Check your website, Google Stop, Check, and Enjoy. Go to the North Carolina Health and Human Services page to see if you should even be fishing in the waters that you're about to drop a line in.
And then you go ahead and use the wonderful recipes that have been given that are safe and healthy. No need to fry, put it in the oven, and enjoy that fish.
And when you finally get that fish back home, if you can check out those websites again and enjoy some of those great recipes that our chefs have shared with you, you're just going to enjoy that fish even more because you'll know it's safe.
This is so important to the community because we want to have a healthier Wilmington, and we have a healthier one by informing the public.
We're all neighbors. We all should look out for each other. Whenever anything bad happens here, hurricanes, tornadoes, we're all there for one another. This is no different. You know, just because someone hasn't been blessed enough to eat safe fish or be able to afford safer fish doesn't mean that they deserve to eat something that's polluted. And so it's important for all of us to come together, work together, share our knowledge, and make sure that everybody stays safe and healthy. So go out there and enjoy the Cape Fear River Basin, enjoy fishing, enjoy North Carolina, and thanks for listening.
So as
All
you
right.
can- Yeah.
Today we're talking.
Oh, oops, sorry. So just to say again, so that was Veronica Carter and Deborah Dix Maxwell, two of our favorite community partners. And again, using their voices, right? It's not us, it's not Duke University who's up there telling, you know, a bunch of scientists coming from an academic institutions, telling people what to do, right? It's local voices, local trusted voices, really talking to folks that they care about, talking to their own communities, and having a conversation. It makes a huge difference. The messenger matters, is a common saying. And
We're not going away. We live here. They know where to find us if they need to. And that's important because unfortunately, you know, as much as I know a lot of you do care and put your hearts into your work, but you go home. You go back to your homes and to your base universities, and you're there, and you move sometimes on to the next project. They know we're going to be here for them. We've been there for them in the past, and we're going to be here. So if they have questions, they have run into problems, they have concerns, they know where to reach us.
And that's really, again, the power of doing community-based work and community engaged scholarship is that you get to work with the people who know deeply and care deeply about the places where you work and the people you're working with. And they're the ones who are going to be change makers. We are not. We help co-produce knowledge, but it's these folks who are going to be making the change.
But we also know where you are.
Yes, you do. You have my cell phone number.
And so, and
use it.
and that's important though, because, you know, if we get stumped for a question or a new concern comes up, they now know that we have access to people at a world-renowned university system that we can go back and say, I don't know the answer to that, but I know somebody who can help us find it.
Yeah, and that is the power of community engaged scholarship. That's the power of participatory action research. And just to say, you can see that this cycle of the research, participatory action research was followed in this process. Certainly, we used the knowledge that we co-generated with the community. And we also then use that to act, to decide together, to apply the results to act. We also work to synthesize generalizable lessons learned, and we replicated and disseminated. We actually conducted multiple rounds of research. Once we realized that there was not enough information about actually what contaminants were in fish because a lot of the advisories were out of date, we actually conducted fish tissue testing to figure out what other contaminants were available. We worked with policymakers then at Department of Health and Human Services to use that data to set new fish consumption advisories, which are much more restrictive. We then updated our materials accordingly. We conducted further research on, again, who is eating fish from the Cape Fear River, how they're consuming it, and we updated our materials even further and adjusted our strategies accordingly. I'm going to stop there because I do want to leave some room for discussion as well, but we will put our links to our contact information in the chat. We will also put links to the videos if you'd like to watch them and to our materials. Abdullah, there you go. Oh, shoot. Yes. Veronica, you want to say something quickly about that one? That was a good
When you
one.
said update materials, I realized we didn't show this.
I
This is
know.
this is Cape Fear Kids, and I hope you can see a little bit of it. It's a little comic book. Okay. And so we took the information that we had because a lot of our kids, we were getting into the middle school, high school, upper elementary school level. A lot of the kids that were out there, especially in the Hispanic community, they go to school, they speak English. They're their parents' translators. And so if we could get them, give them something to read and understand, they, when they're out there fishing with mom and dad, would be able to say, hey, whoa, 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 you need to throw that catfish back, daddy, because look, here's my book, or here's the website we need to go to, or here's the QR code we need to scan, because that's not quite the healthy one. Let's keep this one, but let's throw that one back. So we came up with a comic book too. That was the very last thing that we just come out with this year.
Yep, that was the most recent. I'm going to stop sharing so that we can see each other. And I think that we are down to just us at this point. So maybe we don't do a discussion.
Oh,
and
actually, Emily has some questions. Emily, you feel free to, if you're there, and want to come in and
Okay,
just
let me see
have a
what it
chat.
says here. I'm sorry. Whoa, you had a lot of questions. Sorry, they were like, what did the trust building look like to get community members comfortable with engaging with researchers? Pretty much, we had to be there. Initially, we had to be the folks that introduced them. In many cases, and Liz has Sam isn't on today, but Sam is like their translator, which I think is so cool. Because again, you guys get used to talking to each other and doing presentations, and you're speaking at that whole peer review level. And everyone in the community is looking at you and smiling like they understand what you're talking about. And the rest of us are looking at them like realizing that their eyeballs are about to roll in the back of their heads. Because if I say to them, now tell me what they just said. And they'll be like, yeah, because they don't want to appear foolish or less than educated. So many times what will happen is Liz might present something and then Veronica will stand up and go, let me see if I understood what you just said. Did you just say? And I'll kind of bring it down a little bit of a level so that I know that they got it. And so that's one of the ways that we engage and they get used to it. And that's just the technique, frankly, I learned in the military. You make somebody repeat back to you in their own words what you just said to them. And if they really got it, you'll be able to tell. But they probably won't admit it. Okay, these community engagement practices are not typically taught well in primary education. You're right. They're not even necessarily taught well in higher education, frankly, as someone who has a master's degree. Some of it is I'm fascinated and love the work that Liz and the folks do at Duke. I think it's so important because so many grassroots organizations, so many nonprofit organizations, particularly the grassroots ones, hit a block because if they're trying to stop something that's environmental injustice, they're going to need more than just emotion because then they're just accused of being tree huggers and they don't know what they're talking about. They're not educated. They're running. No, so you need hard facts. You need people like you to come into their lives and say, no, they're lying. See, it really is. It's toxic. It's dangerous. It's a known carcinogenic. Here it is. So that's so important. But many times community groups don't know how to reach you guys. There may not be a community engagement program at that local university. And so I think programs like this and getting the word out and maybe modeling it for other institutions is so important. Did that answer everything, Emily? Maybe, kind of, sort of, maybe? Hopefully.
Yes, it did. Thank you so much. I've really enjoyed this.
Thanks. And thanks for sticking around, Emily. Thanks for your great
Yes, thank
questions
you.
and for sticking around.
Emily, what part of the Duke University you are part of?
Hey, I'm from Sustainable Duke. I'm under Sustainable Duke team. So I do hope to be having collaborations with all of you. Thanks.
Well,
Yeah.
very much looking forward to as well.
We will keep the conversation going, Emily. I think we've already been connected, but we'll make sure you're connected back in too.
this might be somewhat an ignorant question, but very quickly, why just the fish? What about the water consumption of these rivers? If people
Well,
drink water or swim in the water, does that pose a similar health dangers?
it does, but interestingly enough, there were already drinking advisories and swimming, as Liz pointed out with the sign. You may have noticed that one picture we had, it had a no swimming.
Yeah, don't
Yeah,
swim.
and probably because if you jumped in the certain parts of the Cape Fear River, when you came out, by the next day you were covered with a rash or something that somebody was trying to figure out what caused your skin to go ablaze. So consuming it seems to take longer. But in 2017 is when we discovered Genix in the Cape Fear River. And so most people kind of sort of knew not to directly drink the water, but they weren't putting together, oh, wait, it's okay for me to eat the fish who are living in the water, that whole food chain thing. I was science for the non-major in Rocks for Jocks. So I get that not everybody will kind of make that connection of just because I'm not drinking the water doesn't mean I'm not ingesting the water.
Right.
So I think that's what and again, in many cases, it's just out of necessity. They need the fish. It's free.
I know.
Especially if you don't have a license.
Quite
Yeah.
Don't get caught.
Go ahead.
Uh,
Okay.
I think this was incredibly fascinating. Liz and I, let's go and visit Veronica in Leland.
Mom,
I just updated my dinner menu from salmon.
Okay.
Just you inspired me. But thank you.
Liz has eaten at both Catch and at Seabird, so she can vouch for our two chefs very much.
Thank you very much. Please keep these conversations going. Hopefully more people will be joining us in the future ones.
That sounds good. Thank you so much for hosting, Abdullah, and Veronica, as always. It's such a pleasure. Alicia, I think thanks for
Veronica,
providing
nice to meet you.
great.
Thank you. It was great meeting all of you, and thank you for inviting me.
If you're
Bye,
ever
everybody.
at Duke or in Durham, please let me know.
I shall.
All right.
Bye-bye, everyone. Thank you.